So my name's Andrea Silvas and I am a MedPeds intern. And what do I love about this program? Well, I think from the beginning, it's just been amazing support. I think that's been the first thing that stood out to me. I struggled a lot with just like increasing anxiety when I first started the program, and just like from the beginning, everyone just like wrapped themselves around me and provided me with like all the opportunities that I needed to be connected to like mental health resources and everything that I absolutely needed. And so that's been probably the thing that has stuck out to me the most, just the amount of support and love and like affirmation, and just like I am not alone in this place at all, and it's been absolutely amazing.
We have a great group of residents here in the MedPeds program, and I'm continually kind of in awe of my colleagues, and it always feels like we have really big shoes to fill from the upperclassmen. They just are all really incredible doctors. And I have already grown very close to my intern class as well, so there's definitely a huge sense of community. In planning to come here with a family, there were a lot of things that I had to figure out before even moving to Baltimore. Things like childcare, who's going to be my daughter's pediatrician, what kind of things we were going to have in place before we even moved to Baltimore. And the leadership was really good about directing us in certain ways and helping give us recommendations for how to get our stuff established before we got here, since that was really important for us.
I mean, it's been a hard experience in the transition, but being in an environment where there's really a group of people that's supporting me and letting me know that I can get through these challenges, and knowing that I'm always safe in the decisions that I'm making, it's really been something that's been comforting in this really hard beginning journey so far. And then really feel part of bigger and a larger family. The urban health program for internal medicine is only 4 interns a year, but we're part of the greater class of 50 in the categorical program. And throughout my time on the inpatient side, I've really felt the exact same as everybody else in the program. And it really adds a layer of complexity and diversity that I really appreciate as part of this program. Not only in being part of the like-minded individuals in my urban health cohort, but then learning from the people in the categorical program that really have a wide range of interests, and we're really able to mix and share those ideas because we can bring some of the categorical people over to our urban health rotations and can learn from a lot of their other interests as well.
I remember receiving my match day envelope and being absolutely terrified. First and foremost, that I was coming to the Osler Hopkins residency training program. Definitely had a lot of imposter syndrome the first couple of weeks. And what I have learned since then is that the people here are super kind, friendly, willing to let you learn. My very first day on the rounds, ACS rounds, I was pimped on an EKG very formally. And what I remember about that experience is not like how scary it was, but it was the fact that my co-interns were actually cheering me on through that experience, being like, "You did a great job finding the QRS."